Well, Professor Alex Van Den Heever is at the Wits School of Governance. Professor Van Den Heever, good evening to you, and thank you very much indeed for your time. There's so much contestation around the NHI. People who support it say that it will mean that there'll be more access to private facilities for poorer people. People who oppose it say it'll basically wreck the system that we have. What do you think will happen if the bill is implemented as it is currently?
Well, as it is currently, the bill is, in many respects, magical thinking. It's not going to give better access to private or public services because none of the core problems dealing with access in either the public or private sector are addressed by the proposals. In essence, the simplistic version of these proposals is that it's just a great big purchaser who intends to buy healthcare using methodologies that the government and even the private sector have never used. So it is a completely untested regime, and no promises can be made on the basis of what is very likely to be a rather dysfunctional institution, particularly given that its governance structure, its corporate governance design, pretty much mimics every single public entity that has failed in South Africa to date, and not failed in a minor way, but failed spectacularly. And this would really, that's why the expectation is that any attempt to convert our entire health system squeeze it into the box of this particular proposal is going to do nothing but disrupt both our public and our private systems without rectifying the stuff that isn't working today.
The main point, as I understand it, the sort of principle behind it, is to open up the private healthcare sector to everyone and make government sort of be the payer. I mean, I'm oversimplifying that, and there are problems with putting it in that way. Is there any way to actually do that in a sustainable and meaningful way?
No. The private sector is smaller than the public sector. So the incorporation of the private sector into the public sector doesn't actually address any of the resource-related issues in our health system. It makes really no material difference to the access to services pre and post such a design. There's no real way that you can also mix the way in which the private sector operates to the way in which they intend this public sector arrangement to operate. There's no way that everybody's going to have a GP that they select or go to their specialist. There is no way that that's going to happen, and they don't really have a clear design for any of that. It's really all just paper. So the concern really is that they've overpromised what such a system can deliver on. There's no evidence to support it, and there's also no evidence of the problems they're trying to solve. It is largely an evidence-free set of proposals that have no appraisals, no analysis, no clear assessment of what kind of problem they're trying to solve. And even though it is being kind of fronted as if it's kind of an equity-inducing machine, there is actually no analysis of any of the equity-related issues that would motivate this proposal. So this is where the problem lies, is that these proposals themselves just have not been assessed. And there's a reason they haven't been. It's because if they did the assessment, it won't make the case. And on top of that, the processes that have been involved in this raise all sorts of constitutional questions about whether or not any of this legislation should be passed, given the way they've, essentially ran things through.
You will know, Professor, I'm sure you'll know Dr. Nicholas Crisp. He's the Deputy Director General for the NHI and the National Health Department, and his argument is that this doesn't need to be funded. It will be funded through the government budget. It would become law this year and presumably through the budget process next year or maybe the year after that. And that's really where we would start to see changes. Is there anything in that defense of the NHI?
No, it's absolute nonsense. Essentially, we're restricted. So it's important to note that the way we raise general taxes depends on a range of different tax bases, all of which kind of hit their limits, their ceilings, where if you increase the tax rates beyond a certain level, you actually get less tax revenue. So general taxes are different to medical scheme contributions, which people are paying because they're getting something back for it, so they're willing to make that payment. So what they're suggesting is that what they'll do is prohibit those contributions and those benefits so that you're forced into the public system and somehow you will agree to pay higher taxes in order to access what the state now provides. That is just magical thinking. The reality is that they will raise no more money out of general taxes than we're raising today. And what we raise from general taxes depends fundamentally on our economic growth rate. And at this point in time, our long-term growth rate is just under 1%. And that's largely because of all of the structural features of the economy that have been harmed by other state-owned enterprises. So the challenge at the moment is that these kinds of proposals, which depend on exorbitant increases in government revenue, don't actually have a revenue base for them.
Professor Alex Van Den Heever, thank you. Strong view from the Wits School of Governance.